America has now hit the grim milestone of 1 million confirmed cases of the coronavirus. In the 1 month since recording the What Went Wrong series, America has gone from freshly becoming the global epicenter of the coronavirus, overtaking Italy in late March, to the first country with 100,000 confirmed cases, and to now becoming the first country in the world with 1 million confirmed cases. Even worse, sadly more than 59,000 Americans have lost their lives. In order to understand how the coronavirus became so prevalent in the United States, we need to first understand what caused the United States to become the global epicenter of the coronavirus. Hello and welcome to the Quarantined Life. I need to start this video with a disclaimer. This is a relatively unaltered combination of the 4-part video series I wrote and published between the 27th of March and the 6th of April. The only changes made are some quality of life changes, and the audio will remain the same for authenticity. However, if you're looking to understand why things are so bad right now, this video will highlight the key factors and major players that contributed to the United States becoming the epicenter of the coronavirus. So, as you may have heard in the news recently, the USA is now the epicenter of the coronavirus pandemic. It is now leading the world in the total number of cases at over 100,000 people infected, with over 1,500 deaths. So I just want you to stop for a second and think about, how did we get here? Just to give you some perspective, look how big the United States is in comparison to Australia. In actual fact, the United States is larger than Australia by approximately 2 million square kilometers. It's not just one of the largest countries in the world, it's also one of the most populous countries in the world, ranked third behind China and India with around 331 million people. Within the United States, there are 50 states with differing levels of state rights and demographics. And to compare it to somewhere like Australia, which only has 7 states, you can already see that it would be a massive task coordinating a response to a viral outbreak such as coronavirus. Here's a look at the main cities by population in the United States. You could imagine that if there was an outbreak in a city with a population of over 8 million people, like New York City, it could potentially be a massive problem. The unfortunate thing, though, is that there is actually a massive outbreak going on in the state of New York, which New York City resides in. Also, the state with the second largest city, Los Angeles, is the third largest total case group for coronavirus. This is going to be an enormous problem going forward. I think it's really important to understand that the coronavirus is not just the flu. Those who are admitted to hospital for seasonal flu have an average day of around 5 to 6 days. The incubation period is around 2 to 4 days. The death rate is only around 0.1% in the USA. And most importantly, it's a known virus and there are vaccines available. In comparison to the seasonal flu, with the coronavirus, 20% of patients are serious enough to be sent to the hospital. Within the hospital, the average day is around 11 days, 5 to 6 days longer than the seasonal flu. Continuing, the death rate is between 2 to 5%. The incubation period, it's around 5 days with a maximum of 10 to 11 days. Basically, that means you can have the coronavirus and be spreading it for 5 to 11 days without even knowing it, and without even showing symptoms. Also, there is no coronavirus season, as it is simultaneously occurring in both winter and summer across the globe. However, the most important part to take away is that it's a novel virus. It is unresearched and there is no vaccine. And just a quick word on vaccines, they can take years to develop and safely test. Looking at the total corona cases in the United States now, you can see the United States is experiencing exponential growth. For those who don't know what exponential growth is, it's basically where the growth rate becomes ever more rapid in proportion to the growing total number or size. In order to understand how the coronavirus became so prevalent in the United States, we need to take a look at the United States coronavirus timeline. On January the 21st, 2020, there was the first confirmed case. By February 29th, the United States had their first death. March 2nd, US cases topped 100, rising to 1,000 on March 11th. It wasn't until March the 13th that Trump declared a national emergency. By March 18th, US cases had topped 10,000, and now, as of recording this video just 10 days later, US cases have eclipsed 100,000 with 1,700 deaths. And with all that information behind us, we can now look at the juicy stuff, and can finally have a look at what exactly went wrong. First, we start off with the team in charge, and those who are responsible with dealing with the pandemic in the United States, the Trump administration. A bit of context before going forward. In 2016, Obama created the Pandemic Preparedness Office after the Ebola epidemic. In May 2018, President Donald Trump's Biodefense Preparedness Advisor warned that a flu pandemic was the country's #1 health security threat, and that the US was not prepared. There appears to be a lot of conflicting reports of what actually happened to the pandemic response team, but ultimately, in 2018, the staff that were involved in a pandemic response were either fired, relocated to a different department, or left the administration altogether. These staffers had an intimate knowledge of epidemiology and constantly monitored a range of global health threats. The really bad thing, though, is that they were never replaced until just recently. Moving forward, though, we need to talk about the Center of Disease Control, otherwise known as the CDC. The CDC is responsible for preventing, detecting, and responding to the spread of diseases in America. Leaked internal emails show just how chaotic it was behind the scenes at the CDC, and how much they underestimated the threat of coronavirus in the United States, even as it was gaining a foothold. Basically, the emails showed that the director of the CDC was downplaying the risk to the general American public in the early days, and they were having difficulty keeping track of Americans who had the coronavirus. There was also confusion on which testing criteria to use. It was a whole mess. Now, let's have a look at the leader of the Trump administration, President Donald Trump. Since we now have an understanding of how coronavirus propagated through the United States, we should look at Trump's responses during that period. Here I have taken some quotes over the time used by Trump to demonstrate his understanding and response during this time. I don't want to read each quote, but I think it's much better demonstrated in a video by recount.com, which I'll play next.
We have it totally under control. It's one person coming in from China.
We think we have it very well under control.
We pretty much shut it down. Coming in from China. You know, in April, supposedly it dies with the hotter weather. When it gets warm, historically, that has been able to kill the virus.
The people are getting better. They're all getting better.
And the 15 within a couple of days is going to be down to close to zero.
It's going to disappear. One day, it's like a miracle. It will disappear.
And you'll be fine.
They're going to have vaccines, I think, relatively soon. Not only the vaccines, but the therapies. Therapies is sort of another word for cure.
We're talking about very small numbers in the United States. Our numbers are lower than just about anybody. It's really working out. And a lot of good things are going to happen. And we are responding with great speed and professionalism. It's going to go away.
Yeah, no, I don't take responsibility at all.
We're going to all be great. We're going to be so good. This came up, we came up so suddenly. This is a pandemic. I felt it was a pandemic long before it was called a pandemic. All you had to do is look at other countries.
Before continuing, I'd like to do a thought experiment. If your car broke down, for example, would you go to a crystal healer or a mechanic? If you had to sit a science exam, would you go to a scientist or an accountant for help? I think you know where I'm going with this, but if you have to deal with a national health crisis or a pandemic, would you go to Donald Trump or health experts? The Reddit user Popping Cream beautifully summed up reasons why people should not take healthcare advice from Trump. I think it's important to briefly go through each of these statements. Firstly, President Trump believes that the human body has a finite amount of energy, like a battery, and that exercising will kill you. Secondly, the president was once an ardent anti-vaxxer. He believed doctors pumped kids full of vaccines that caused autism. Thirdly, President Trump believes the sound from wind turbines can cause cancer. And fourth, he mocked concussed athletes and the NFL's handling of brain injuries, basically downplaying CTE, or chronic traumatic encephalopathy. Even at a recent press conference, President Trump falsely claimed that the FDA approved a malaria drug known as chloroquine to treat patients with COVID-19. Essentially, a man died, and his wife is in a critical condition after they consumed fish tank cleaner because they wrongly assumed that the chloroquine in the cleaner was the same thing as the malaria drug. It's a psychological phenomenon where basically the more you know, you suddenly realize you don't know anything because the deeper you look, there's actually so much more to learn. This is called the Dunning-Kruger effect. The Dunning-Kruger effect is a cognitive bias, and people who are incompetent at something are unable to recognize their own incompetence. And not only do they fail to recognize their incompetence, they're also likely to feel confident that they are actually competent. How does this relate to Donald Trump?
Basically, by using the Dunning-Kruger effect, we can show that Trump's inexperience and lack of knowledge, even regarding the fundamental of science, puts him here, whereas his confidence in everything, including science, actually shows his lack of competence.
Going forward though, an article by Mika Zenko makes some great points regarding Trump's leadership. Firstly, no matter how ill-informed or inaccurate of something, Trump remains completely anchored to his initial impression or judgment. Secondly, Trump's judgments are highly transmissible, and they infect the thinking and behavior of nearly every official or advisor who comes in contact with him. And this is why he surrounds himself with people who look, think, and act like he does. Thirdly, the poor judgments soon contaminate all the policy-making arms of the government with almost no resistance or even reasonable questioning. In essence, he's made an echo chamber for his administration, where those who agree with him stay, and those who don't are forced to leave, including those who may be most adept at whatever situation arises, such as the coronavirus pandemic. Perhaps one of the greatest problems that the US faced in preventing the spread of the coronavirus in the early stages was that the Trump administration declined to use the World Health Organization's coronavirus testing kits. In fact, by the end of February, the World Health Organization had shipped testing kits to nearly 60 countries, and the United States was not one of them. Unfortunately, what this led to was that many cases of coronavirus were being undetected, and thus perpetuating the spread, either overtly or silently. Additionally, what this meant was that there was actually a massive amount of underreporting in the early days, and this contributed to the spread of coronavirus in the United States. To show you how poor the early testing was in the United States for coronavirus, by the 9th of March of 2020, only a bit over 4,000 people had been tested for the coronavirus nationwide. And the thing is, this is almost 2 months since the first confirmed case in the United States had appeared. In fact, by March 16th, the United States had the lowest testing rates per capita of any country affected by coronavirus. In the United States, with a population of around 330 million, they had only tested roughly 11,000 people, whereas South Korea, a country with 51 million, was testing nearly 20,000 people per day. It's also interesting to note that the two countries announced their first known cases of coronavirus just hours apart. However, on the 25th of March, Donald Trump tweeted that they had done more testing than other nations. And I don't really know why testing is in quotations, but it is. But looking a bit deeper at the stats, as of the 24th of March, a bit over 348,000 South Koreans had been tested, with around 9,000 being confirmed to have the virus. Before moving on, I want to point out that unfortunately the CDC does not put up updated aggregated counts of tests in public and private labs. However, the majority of them are done in commercial and not government-run labs. And just to point out how crazy this is that the only place to currently get the levels of testing is to look at the COVID tracking project, which does not get its information directly from the government, but by things like state and territory public health authorities, trusted websites, tweets, and Facebook updates, which are then collated, analyzed, and published. As already mentioned, although both countries reported their first cases of coronavirus on the same day, South Korea's testing rate is already 6 times higher than the test rate in the US. So far, the US test rate is about 1,000 tests per million, and South Korea's is 6,700 tests per million. And you can already see what this early testing did. Firstly, it allowed the accurate identification and tracking of those infected with the coronavirus, and secondly, it slowed the spread. With America, because there was so little tests done during the initial stages, there was a lag to the exponential curve. And importantly, just because this graph is flat for a very long time compared to Korea's, it doesn't mean that people just magically got sick here. What it means is that people were sick this whole time, they just weren't being tested. And unfortunately what this means is that this exponential curve is going to keep rising for longer than it did in Korea. Before I continue, I just want to give you a quick update of what the stats look like as I'm recording this video. There are now over 140,000 coronavirus cases and almost 2,500 deaths in the United States. I also want you to stop for a second and think that each of these numbers is actually a real person who is either actively suffering or has died from the coronavirus in the United States. The incompetencies of those in charge actually have real-world effects. In fact, at the same time that over 140,000 people have contracted the coronavirus and almost 2,500 people have died as a result of it, Trump has been tweeting about his ratings. And hopefully in another video, I'll go into the psychology and language that Donald Trump uses to gaslight and manipulate. But for now, let's continue with how the United States became the epicenter of the coronavirus. On February 9th, the Trump administration announced that it had sent nearly 17.8 tons, or more than 35,000 pounds, of personal protective equipment to China. And just remember, this is the same country which Trump continues to have a trade war with to this day. The thing is, if you remember in the previous episode, in the coronavirus timeline in the United States, is that on the 21st of January was when the first case of coronavirus appeared in the United States. And by the 9th of March, almost 700 people had been infected by the coronavirus. As previously mentioned, with exponential growth and without adequate preventative measures, this was definitely a warning sign that the number of coronavirus cases were about to soar. There's so much more that can be said of Trump's inactions, Trump's transactional relationships with governors, and misunderstanding of science, particularly from his actions now. But I really want to try and keep this video series focusing on how exactly the United States became the center of the coronavirus pandemic. So we'll move on to the next player in the Trump administration. On February the 26th of 2020, Vice President Mike Pence was put in charge of the coronavirus task force. Perhaps as a fall guy? I don't know, but I guess we'll see. And I find this pretty funny, but here I've provided a tweet where Trump criticizes Obama in 2014 for doing the exact same thing he's doing now. And just a subtle shout out to the subreddit Trump Criticizes Trump, where you can find a lot more laughs. But moving back to the point, I think it's also interesting to note that during the Obama-era Ebola outbreak, the United States had a total of 11 cases with just 2 deaths. I think they did a slightly better job at handling a potential pandemic. However, moving on, to highlight how bad a choice Mike Pence was as the coronavirus czar, when Mike Pence was governor of Indiana, he was responsible for the largest HIV outbreak in the state's history, slashing public health spending, triggering the closure of HIV testing sites, and against the advice of scientists, he banned needle exchanges, which led to increased transmission due to needle sharing. Also, he once wrote an opinion piece that, and I quote, "Despite the hysteria from the political class and the media, smoking doesn't kill." Not to mention his restrictive abortion bill, denial of climate change, and disbelief in the theory of evolution. And as a side note, I also want to point out that under the Trump administration, the White House restricted the speech of public health experts. In 2017, the Trump administration prohibited CDC officials from using a list of 7 words, including evidence-based and science-based, in official documents. As you can imagine, that would make it impossible for scientists to do their job. And you can understand that during a public health crisis such as coronavirus, any censorship would be catastrophic. And next up I want to talk about nepotism involving unqualified personnel. To give you some background to this next part, it is important to understand some of the key players involved. Firstly, in the red, we have Trump's daughter, Ivanka Trump, who is a senior advisor to the president. Ivanka Trump is married to Jared Kushner, who is also a senior advisor to the president. This man on the right is Jared Kushner's brother, called Joshua Kushner, and he is married to a model called Carly Kloss. To show how chaotic it was in the early days of the pandemic, basically Kurt Kloss, who is Carly Kloss's father and a doctor, posted on a Facebook group that, "I have a direct channel to the person now in charge at the White House," and he proceeded to ask fellow physicians on Facebook how they would combat the escalating coronavirus outbreak. And as the Politico article states, the Facebook crowdsourcing exercise showed how Trump's team is scrambling for solutions to confront the outbreak after weeks of criticism for the administration's sluggish response, a shortage of tests, and the president's own rhetoric of downplaying the pandemic. Continuing on this, there are reports that Trump downplayed the coronavirus threat in the early days because Jared Kushner had been telling him that the media was exaggerating the crisis. And Trump's inability to work with others who disagree with him, reliance on unqualified personnel for advice, and the echo chamber of Fox News and rhetoric of fake news are all factors that most likely contributed to the spread of coronavirus in the United States, especially in the early days. I do want to point out that there has been some reporting floating around that Jared Kushner's brother owns a company involved in coronavirus testing. So summarizing this Snopes article, what appears to be true at this time is that Joshua Kushner is the co-founder of the health insurance startup Oscar, which recently released an online tool to locate coronavirus testing centers in some areas. Jared Kushner, at least in the past, has had some financial interest in Oscar. What appears to be false, though, is that Oscar the company is not involved in the actual process of coronavirus testing, or in the manufacturing of such a test. But I don't blame people for being concerned with either Trump or someone within the Trump family attempting to capitalize and profit from Trump's presidency, as seen previously with the complete disregard for the emolument clause and many other presidential decisions which have benefited Trump, his family, and allies either indirectly or directly. The next important player that we really need to talk about is fake news and misinformation. Over the last 3 years of Donald Trump's presidency, he has spoken more than 16,000 misleading or false claims. The biggest problem here is that people actually believe everything he says, regardless of its validity. And as we've previously talked about, the problems with misinformation and lying, particularly when it comes from a position of power or authority, can have real-world consequences. And unfortunately, we're seeing the results of this all right now in the United States. In fact, in just the first 2 weeks of March, Donald Trump has made 33 false claims about the coronavirus crisis. Not to mention the countless examples already discussed during the Trump coronavirus timeline. The big problem here is that he's been using the daily press briefings to the nation, which is supposed to be informative and factual, as a substitute for his Trump rallies, and they're rife with misinformation and inaccuracies. However, continuing on with fake news and misinformation, during the early days of the United States coronavirus crisis, not only were falsehoods and misinformation being propagated by perhaps the most powerful man in the world, it was also being touted on his favorite news channel, Fox News. The danger here is that a large percentage of Americans were getting their information from one highly biased source. To give you an example of the type of language and the changing rhetoric of Fox News over time, I'd like to show you a clip.
This is yet another attempt to impeach the president. And sadly, it seems they care very little for any of the destruction they are leaving in their wake. We must test for the virus in order to stop the spread of it. What could be a very great recession. Some predicting even a depression.
At worst case scenario, it could be the flu.
I feel like the more I learn about this, the less there is to worry about.
I was about to say the same thing. We don't have immunity to this virus. It's a new virus. It's a pandemic strain of a virus we haven't seen before.
All the talk about coronavirus being so much more deadly doesn't reflect reality. Without a vaccine, the flu would be far more deadly. We are facing an incredibly contagious and dangerous virus that is moving across the world from one hotspot to another.
It's actually the safest time to fly. Everyone I know that's flying right now, terminals are pretty much dead.
I think you get the point, but please see below for the full clip. However, there is some potentially good news. There are reports that Fox News is worried about legal action regarding the misleading of their viewers about the coronavirus situation. Whether that plays out, I guess we'll see. But as previously stated, because of the misinformation, many people will unfortunately die as a result. The really sad thing about this is Trump's inability to take any responsibility whatsoever. In a recent press conference, when asked about whether he should take responsibility for the failure to disseminate large quantities of tests earlier, Trump stated, and I quote, "I don't take responsibility at all." The thing is, Trump always takes the credit, but never the blame. In fact, just in the last few weeks, Trump has blamed everyone except himself or his administration, including Obama, governors, hospitals, and even the first responders. And here, once again, we have a brilliant example of Trump criticizing Trump. This is a quote from 2013. It says, "Leadership, whatever happens, you're responsible. If it doesn't happen, you're responsible." Sadly, he didn't live up to these words. And just to finish off, The president is currently saying that if only 100,000 people died, he did a very good job. I personally don't agree that that constitutes a very good job at all. In fact, as a result of all the points I've previously discussed, such as slow testing rollout, incompetence, misinformation and hubris, potentially hundreds of thousands of people will die. In fact, the nation's leading expert on infectious diseases and member of the White House, Dr. Anthony Fauci, has said that anywhere between 1 and 2 million people could die in the United States as a result of the coronavirus. Now, to be fair, that is the estimated upper limit of people who could die, but I think what's most important going forward is to watch for the goalposts and to see if they move as time goes on. I just want to do a quick shout out to Dr. Anthony Fauci. Here you have an esteemed medical professional, caught between a rock and a hard place. As we've previously highlighted, Trump removes those who disagree with him. And I truly believe that Dr. Anthony Fauci knows this and is trying to ensure that the public gets accurate information out while simultaneously trying to not get removed and replaced by a Trump sycophant. I have no doubt that this would be a very difficult task, so massive props to him. We can't talk about how the United States became the epicenter without talking about the United States health system, the system that is tasked with dealing with the localized viral crisis. The US healthcare system is a complex mixture of both private and public facilities, institutes, and insurers. I won't go into specifics regarding healthcare, but what I want to do is focus on factors involving healthcare that most likely impacted on the United States becoming the epicenter of the coronavirus. First, I think it's important to note that a lot of Americans do not trust the US healthcare system. In a 2018 Gallup poll, only 36% of Americans reported that they had a great deal or quite a lot of trust in the medical system. Part of the reason is due to the way that the healthcare system is set up. In the United States, there is a greater autonomy for hospitals and clinicians, and therefore any problems within the system are blamed not just on the government, as they might be in countries like England or Australia, but on healthcare providers. The big problem here is that those who don't trust their physicians are less likely to take their medications, follow doctors' advice on healthy behaviors, and more likely to skip vaccinations. Part of the problem appears to be that people don't trust the healthcare system, and thus don't trust doctors associated with those institutions. Continuing on though, Drew Color, a New York physician, wrote that, perhaps most concerning is evidence that low levels of trust can weaken the ability of governments and public health agencies to respond to epidemics. The study referenced in this article looked at Liberia during the Ebola epidemic, and suggests that Ebola spread more widely and persisted longer than it otherwise would have if there was higher levels of institutional trust. Before moving on, I just want to make it clear that the purpose of this video is not to be a debate about private versus public health insurance, or the pros and cons of universal healthcare. However, I'm curious to know what you all think of the US healthcare system, so please leave a comment down below. In the United States, around 58% of healthcare facilities are operated by the private sector. The United States currently spends a massive percentage of their economy on healthcare. They spend almost twice as much as the UK and Australia, which both have universal healthcare. A lot of the costs are chalked up to administration costs, which are sometimes called back-end functions, which basically means that a lot of people are sticking their hands out to get a piece of the money flow from medical expenses. Part of the distrust in the healthcare system appears to come from the disconnect between how much Americans pay for healthcare versus how much they actually receive. As I said previously, I don't want to go too deep into it, but basically the hospitals, pharmaceutical companies, and other institutions charge individuals whatever the price they want, and then the insurer will negotiate them down. In fact, generally, the only time that most patients find out the price is after the treatment has been delivered. Unfortunately, what this appears to create is not only distrust with the healthcare system, but also the fear of potential bankruptcy, due to the possibility of an exuberant hospital bill for treatment. Sadly, compounding this is that in the United States, there are around 30 million Americans who are without health insurance. Health insurance in the United States is generally privatized, with 67% of the population having private health insurance coverage. In addition to this, health insurance in the United States is generally tied to having a job. So if you don't have a job, you don't have health insurance, which is a key factor we will address shortly. It has recently been reported that Vice President Mike Pence met with a group of large private insurers who agreed to waive co-payments and deductibles for coronavirus tests. However, the National Trade Association, American Health Insurance Plans, clarified that the out-of-pocket costs for treatment would not be waived, meaning that people who face deductibles could be on the hook for large costs. Even with private health insurance or employer-based health insurance, a recent study looking at the cost of inpatient admissions for coronavirus treatment in the United States predicted that the average cost of coronavirus treatment for someone with insurance would total around $9,700 for someone without health complications, and for someone with complications, it could top $20,000. However, the insurance that someone would pay out of pocket varies depending on their plan, but the study estimates that it could exceed $1,300. Just to give you an idea of how big the hospital bills could be if you didn't have health insurance, there are reports of coronavirus treatments in the United States exceeding $34,000. And you can imagine, even in the best case scenario, if you had to fork out $1,300, which isn't a lot of money to own, but is a lot of money to owe, It would dissuade people from seeking medical help during the coronavirus crisis and thus lead to deaths and increased spreading. The crazy thing is that a recent survey revealed that 69% of Americans have less than $1,000 in savings. Even worse than this is that 45% of Americans say they have $0 in savings. You can imagine, with the cost of hospital bills, medicines, and other costs, adding in a pandemic could be devastating for the average American. In fact, 54% of Americans already worry about the expenses tied to coronavirus, as they say that they're not prepared to handle a contagious disease that may limit their ability to work for weeks. Continuing on this though, only 29% of workers are able to work from home, and while 73% of workers nationwide have access to paid sick leave, most do not have enough accumulated to be able to take off 14 days for quarantine. The big problem here is that it's a catch-22. You either take time off work and are potentially unable to support yourself, or you go to work and you spread the virus even further. As we now know, many people may in fact be asymptomatic, and this is going to be a huge problem in the United States in attempting to limit the spread. Unfortunately, due to the coronavirus crisis, there are now more than 10 million additional people filing for unemployment benefits, with some economists predicting a loss of at least 20 million jobs. Just have a look at the graph explode. The really bad thing though, is due to not having a job anymore, a lot of them lost their health insurance. So unfortunately, summing up healthcare in the United States, you have general distrust of the healthcare system and associated medical professionals, healthcare that is cost prohibitive to many Americans, people with limited ability to take time off work to survive, and the general issue that if you don't have insurance, you may be potentially turned away from receiving medical treatment. Lastly, to finish off, we need to introduce another player called Mitch McConnell, who is the Senate Majority Leader. Apart from all the numerous atrocious things he has done during his tenure in the United States, I want to focus in particular in regards to the coronavirus. Basically, recently he claimed that impeachment prevented action on the coronavirus crisis, and apart from being an asinine defense, we should investigate a bit deeper. Firstly, it's important to note that impeachment ended on the 5th of February 2020. And what was Trump as president doing during this time? Well, he was going to the golf course and holding rallies. Rather than focusing on the coronavirus crisis in the early days, he was promoting himself and enjoying himself, and not to mention funneling money into his own pockets through his results. In fact, Trump has spent the equivalent of 334 years of presidential salary, or more than $133 million, to golf at for-profit resorts, including his own at Mar-a-Lago. And just some quick maths, if we take the average cost of a ventilator at being around $40,000, that would equate to an additional 3,345 ventilators being available right now. I also want to highlight something very interesting regarding his daily press briefings since enacting rules about social distancing, restricting his ability to hold rallies. The Trump administration has not held White House press briefings for over a year, as of March 11th, 2020 as noted here. But then, all of a sudden, we had the coronavirus task force briefings pop up. As previously mentioned, the main reason for this appears to be that since he was unable to hold his rallies, he and his administration realized that he could use the coronavirus press briefings as a substitute for the rallies. The sad thing is, this has continued Fox News in propagating their agenda, and thus the cycle between Fox News and the Trump administration continues. Here we can see that Fox News reports that Trump's daily briefings are a success. The really big problem here is that the coronavirus press briefings should not be used as a political tool, but instead as a factual and informative session delivered by health experts and those most adept at handling the coronavirus crisis. Millions of Americans rely on appropriate and relevant information during this time to prevent the spread of the coronavirus and help those who need it. This is not the time for promoting one's political agenda. In good news, it appears that the media is catching on to this, with journalists skipping the daily coronavirus press briefings, saying that they just don't offer enough news value. As anyone who has watched any of these press briefings would know, instead of delivering key information and a somber assessment of the situation to the public, he has used the same tactics from his campaign rallies to boast of his accomplishments, push misinformation, attack the press, and taunt Democrats. Going forward, please trust the health professionals and respect the amount of effort those having to deal with the problem have to face. They didn't create the problem, but they'll be the ones fixing it. Wrapping up, I think it's really great to see recent news articles continue to hold Trump and his administration accountable for their unbelievable incompetence. It is important to never forget that the Trump administration could have prevented the majority of this. Thousands of people have already lost their lives, and millions are experiencing hardship and pain as a result of their ineptitude. And I ask all Americans to please go out and vote in November. Do everything you can to get your neighbor to vote. It seems cliche, but the world literally depends on it. Lastly, I hope all my American brothers and sisters stay safe during this time. We're all in this fight together.
There has been so much unnecessary death in this country. It could have been stopped, and it could have been stopped short, but somebody a long time ago, it seems, decided not to do it that way.
I just want to give a massive shout out to all those who have shared the previous video on Twitter and Facebook. It has been unbelievable. You're all doing such a great job keeping those responsible accountable, and to that I offer my sincere gratitude. Please feel free to continue to share any and all of my content wherever you see fit. If you like this type of content and want to help support the channel, please smash that like and subscribe button with your bottles of Lysol. And as we always say here, don't forget to wash your hands.